Okay, let's go for the fourth part, discussing about what we call neuromodulators of sleep. And what we call, neuromodulators. By neuromodulators, we mean some neurochemicals that are modulating the overall functioning of the system. And so we are not talking about, let's say, when we're talking about neuromodulation, sometimes we are talking about, let's say, brain stimulation or neurofeedback. We are not talking about that type of neuromodulation. So when we talk about neuromodulation, there are two lines of definitions that we can have. One line is basically what we do in terms of the neuromodulatory interventions for brain, which is sort of intervention. But when here we talk about neuromodulators, we mean some neurochemicals that are acting in terms of increasing the overall activation or processes that are happening in the brain. And they mainly work in terms of changing the gears between different functions, overall functions in the brain. Let's go back to the figure that we have been discussing about before and we have been seeing before. Just adding one piece to this figure that we have been seeing before, and is related to two major neuromodulators that we have in the brain. One is 5-HT, which is called serotonin, and what we call noradrenaline. And these two materials, these two neuromodulators, are basically REM off. So they are in place in wakeful situation. They would be a little bit lower or in the same level in REM, and they just would be out during REM. And there are some, let's say, REM on neuromodulators like acetylcholine, which is REM on, so they would just be activated during REM. Okay, so these two sort of contradictory mechanisms are involved in sleep processing, and this is how I can show you these processes in terms of in the slow wave sleep we have lower level of acetylcholine, and in REM we have higher. But for noradrenaline and serotonin we have the same level of being awake and lower level during REM. And for things like cortisol is acting like acetylcholine, so we have decreased level of cortisol during slow wave sleep. So you have, and cortisol is basically the stress hormone. So the stress hormone would be lower, but it would be up in the REM sleep. And we probably have the highest level of cortisol, something like early in the morning before you get out of sleep. There are different neural pathways that are involved in these neuromodulators, whether they are acetylcholine. Here you can see histamine. This is serotonin, noradrenaline, acetylcholine, dopamine, orexin. So these are the different neurochemical modulators in the brain. I put this figure to just tell you that you are not supposed to learn, detailed names that we have here. This is not what I'm expecting you to learn, whether, for example, this one is basal forebrain, or this is a rafenoclose, or preaqueductal gray matter. So, all those names that we have here, I'm not sure that they are critically important for us in terms of the cognitive neuroscience part, because most of them are from, let's say, the animal models, and they are really hard to be explored in human models. For example, the basal forebrain or some other components of the basal forebrain, We explore them in fMRI studies, but it's still really hard to explore them, and most of them are really hard to be explored in human subjects. So I mean, you need to have, kind of read about them and having a sense about them, but I will try not to ask their names in the exams that we are going to take. So not very much kind of putting too much pressure in terms of you learning all those names that are related to these neurochemicals. But these neurochemicals are definitely playing a role in this process. I'm not going to discuss about the details again. You just need to kind of have a sense about, okay, when we talk about serotonin system, most of the neurons that are modulating the serotonin systems are coming from the raphe nucleus or raphe nuclei in the brain stem, and then they go to other places. And then, as we have discussed about before, locus ceruleus, which is involved in neuroepinephrine system, is located in pons as well. So these are the major pathways that are involved in these neurochemicals. As I told you, there are different neurochemicals that are working in this system. The reason that I basically added this part to this class is that most of the time when we give people medications for sleep, these medications are working on these neuromodulators. And the problem with these neuromodulators is that most of these neuromodulators are sort of state dependent. So they play a positive role for short wave or slow wave sleep phases or non-REM sleep, but they have another role in REM sleep. So they have differential roles in these different stages. And the problem for most of these medications is that when we give these medications to our patients, they could have positive effects on the slow wave sleep and then having negative effects on REM sleep. And that is the reason that some of these medications, or most of these medications, they have sort of their consequences. So you do not have the same sleep quality with these different sort of medications that we provide that are interacting with these systems. And that is the other reason that when we have different psychiatric medications, people could still have the same amount of sleep, but the sleep quality would be much lower. So what we expect from sleep is that when you are out of sleep, you are supposed to be fully refreshed. When we have medications for this system, we need to be careful in terms of, okay, sometimes we have kind of challenges for that. As I told you, the expectation that we have from sleep is that when you are kind of at the end of your sleep, early in the morning, the big gift of sleep should be having you completely refreshed. And if you just develop, if you still feel that you still have a sort of sleep depth at the end of the sleep early in the morning, that is the start of some of the problems that we have in some of the psychiatric problems. It seems that is critically an important function for a sleep, to make sure that when we are at the end of a sleep in the morning, we are fully refreshed and we are completely back to the highest functioning that we are expecting to have. So that is important to have a sense about why some of the medications that we give people are going to be a little bit problematic in terms of the functioning that we are talking about. Okay, that is the end of this part.